Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in the field of laboratory medicine and pathology. Hi, Bill. How are you this week?
I'm doing great. How are you?
Very well. I had a lovely weekend, and now, there were not a lot of mosquitoes out, and I think that's very relevant to what we're going to be talking about today. So that was nice when I was out in my garden. But yeah, mosquitoes, ticks, things that we need to worry about.
Yeah, I'm in northern Minnesota, ticks with Gretzky
Ooh.
out and his walks and wanting to get into the. I mean, he went through one. After I've learned from you, parasite gal, he went by one little pine sapling that was in the ground, and he came out. He had two ticks on his face, just to show how they're
Oh,
just sitting there. They're just out there hanging around, but unfortunately, they're not the only vector that's out there, and we're learning
yes.
about one here in the last couple of weeks in the U.S., which is something we haven't thought about in the U.S. for some time. And so maybe we should talk about that.
Yeah, I think we should. And we'll talk about ticks and tick-borne diseases again for sure. But what we've been hearing about now in the media are locally acquired cases of malaria in the U.S. Sarasota County in Florida, and then also Cameron County in Texas. And we are having people that have never traveled outside of the U.S. getting malaria, something that is very, very rare in the US. It is not endemic. So this is quite an unusual situation.
Yeah, so maybe we should just, I mean, just for people to know um, what does that mean? I mean, when you say someone acquired malaria without traveling, where did they get it, and what does that mean for the area that they're living in?
Yeah, well, first of all, I should note that the mosquitoes that are in the US are perfectly capable of transmitting malaria. It's just that back in the 1950s, we eliminated malaria from the US. In fact, most people don't know that we used to have malaria in the US, but through good housing, draining swamps, environmental control, mosquito control, good public health infrastructure, and of course, we had DDT and chloroquine, we got rid of malaria in the US. But the mosquitoes are still there. And if they are to become infected, let's say from an imported case, they are perfectly capable of passing it on to other people. So that
Yep.
is probably what's happening, Bill. It's probably that people who traveled abroad brought malaria into Florida and Texas, and then they were bitten by local mosquitoes who got infected, are perfectly capable of transmitting malaria, and actually did so, went on to bite other people. So we now have several cases in Florida, and they're working very hard on mosquito control to eliminate all those mosquitoes that might be infected with malaria. But there's still some out there, and we're still hearing reports of cases as of just a few days ago.
Yeah, so it's important, right? So it's really it means that there's actually infected mosquitoes like you would worry about if you travel to an area where malaria is
Mhm.
known to be endemic, right?
Exactly.
And it's also really important because probably a lot of physicians and healthcare providers don't think when someone walks into their office with a febrile illness in Texas, their first thing is going to be, "Oh, do you have malaria?" Right? Unless
Yeah.
so I think that really speaks to awareness, number one. To
Mhm.
your point, number two, public health. So because we have eradicated this disease before, and we have to make sure we stay on top of it. And this is not we heard about polio last summer, all these
Yeah.
things, and so a big mainstay again is diagnostics, right?
Absolutely. You have to diagnose infection. So you have to order the correct test, the physician or the healthcare provider who's seeing the patient, but it ultimately comes down to the lab to make the diagnosis because the main symptom of malaria is fever. And we still have COVID circulating. We have other things that could cause fever. And it may be non-specific enough that you really would, that's two very different diseases with different treatments, COVID and malaria. The physicians have to know what their patient has so they can prescribe the correct treatment. And as you said, Bill, no one is thinking, or at least before this outbreak, they were not thinking of malaria in someone who had not traveled outside of the US. So now Our role as laboratory leaders is to help educate and provide that education to the public and physicians. So I've given a few media interviews already talking about when physicians should be thinking about malaria, and then talking about what the correct test is that they should order, which in most places is going to be the gold standard thick and thin blood films, which you're actually quite familiar with your
Yep.
hematopathology background. It's very similar to the thin films that we use in hematology, just doing a CBC.
Yep, that's right. I mean, when I was a trainee, which it seems we used to have a lot of questions on malaria, and you're always like, well, why am I getting questions on malaria? But it's because, to your point, it used to be endemic. So a lot of the older test questions for board certification in hematology would have questions around
Ah,
malaria diagnosis. But
yeah.
the other thing is, as you're speaking, it just makes me think of, what we've been through over the last several years and all the challenges that we had with COVID in terms of trying to maintain COVID. And there was a lot of questions about, does it, does the CDC work? Where was the mistake? I mean, that was so overwhelming that I think people lose track of the fact that we have a very important part of our health care delivery in this country is this interplay between awareness around diseases, communicable diseases, making tests available so we can diagnose them, and collaborating with public health to actually make sure that once cases are identified, we do everything we can to eradicate diseases which start to show up on our shores. We went through this now with monkeypox. We're hearing about with malaria. So I think it's just important that this is, especially now as there's an act in Congress. It's I think it's preventing.
Prevent pandemics or something
Yes,
like
yeah,
that.
something like that.
Hmm.
That to make sure that we continue to fund this because provide the funding because it's so important. The last thing we want is for these diseases to become endemic again and for us having to be trying to deal with them.
Yes, and public health is just of utmost importance. We've had a number of diseases throughout the history of the United States. That have been locally eliminated that could come back. Malaria is one, yellow fever. We had places like Philadelphia that was just would have these terrible yellow fever outbreaks. Talk about a terrible viral disease. Um, Malaria can be really bad as well, potentially life-threatening. Fortunately, the type of malaria that we've been seeing in the current outbreaks is caused by the parasite Plasmodium vivax. So it's not the deadliest of the Plasmodium species to cause malaria. That would be Plasmodium falciparum. But even Plasmodium vivax can cause deaths. If you get a really enlarged spleen and you have splenic rupture, that can be fatal. And it's certainly not a pleasant disease to have.
No.
And you feel terrible. Also, Vivax has the form that is dormant. It remains dormant in the liver, and it could come back months or years later if you don't appropriately treat it. So again, comes back to diagnostics, laboratory diagnostics, the foundation of the medical practice. We tell what the patient has and what specific species, because the treatment for the different types of malaria is also quite different.
Yeah. Wow. So yeah.
Mm-hmm.
So a lot there. But again, it's important that we stay engaged, we stay
Yep.
aware. Our role is really to help educate not just the public, but the healthcare community on how to use testing to really address these things and use it most effectively to ideally eradicate, infectious diseases or
Mm-hmm.
at least keep them at bay. So yeah, so this won't be the last. There'll be
No.
more and more of these coming around, but I sure hope we get rid of because I sure I don't
Yeah.
want to have to. I worry
I
about
don't
enough
want.
when I get bit up there. I don't have to worry about getting a febrile illness that's cyclical with muscle aches and everything, which
Oh,
malaria sounds pretty horrible. So,
pretty horrible. Yeah.
so important we get out in front and that people stay aware.
Absolutely. I think they're going to get this outbreak right now under control eventually through mosquito control, but we will continue to have that role for the next introduction, the next travel related outbreak, or just the next novel pathogen. We will be there playing that essential role.
Absolutely. All right.
All
Well, with
right.
that, I guess we're off to back to enjoying our barbecues and hopefully not worrying about malaria.
Absolutely. All right. Have a great week, Bill.
You too.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and don't forget to tune in every Thursday and every other Tuesday.